Good morning, students. Today, let us start with the new topic health economics. Already, I hope you all have taken the printout of the soft copy which I have uploaded yesterday. So, along with the notes, you can listen to my class because this topic is not available in KPARK textbook. So, it will help you out. That's why I have given you the soft notes. So, when we hear the word health economics, let us first break the word into two health and economics. So, what do you mean by health? There is no need for me to take a long lecture for a final year degree student in nursing regarding health. You all are well aware about health. What is health? Health is the complete state of physical, mental, social, and spiritual well being, and not merely the absence of any disease or infirmity. So, what do you mean by economics? See, economics, we can tell it's a science which is concerned with the use of resources. So, how they are using the resources, we have to use the resources wisely. So, when we use the resources wisely in a health field, then we can tell it as a health economics. So, health economics is an economic system which is related to medical, health, and family welfare services. So, as we all know, health sector is a very big field. So, it really needs a health economics because it controls the scarce resources we have. As a developing country, we India, we don't have plenty of resources, we have limited resources. So wherever we have scarce resources, we have to use it wisely. We have to use it, we have to manage it in a proper manner, so that we can get use of all the things in the right time, so that the development can be taken place. So when we look into the various definitions in the soft note which I have given so many definitions. So which is comfortable for you, you can learn. But at least you all should by heart at least one proper definition for health economics. So we can tell health economics is a discipline that determines the price and the quantity of limited financial and non-financial resources devoted to the care of the sick and promotion of health. Otherwise, we can tell health economics is the study of how scarce resources are allotted among the alternative uses for the care of sickness and for the promotion, maintenance, and improvement of health. That's what I have told. Whatever resources we have to manage that particular resources in order to take care of the sick, in order to promote and maintain the health, including the study of how healthcare and health related services, their cost and benefits, and health itself are distributed among individuals and groups in society. So, this particular branch, that is the health economics, it really studies about how the health sector works and how they manage the cost and benefits and how it is distributed among the individual and the various groups in the society. So, as we all know, health economics is very, very important because day by day, the economy of the health sector or the expenses what as a patient we give to the hospitals, it is getting higher. So it is very important to have a proper health economics. Then only the people will be able to get the quality health care at the right time. So let us see what are the disciplines in health economics. So when we look into the disciplines, there are two types. It is one discipline is related to economics and the other is related to health, as I have told from the word itself, health and economics. So when we tell about the economics, we can tell here we are in health. Under the health economics, they study about the finance, insurances, the industrial organization, the labor economics, the public policy making, that is the finance, how the public sector is handling that, then sociology and the various statistical methods. These all things are highly related with economics. When we tell about health, we all know that health services, the research, medical research, the medicines, the medical ethics what we follow, and the psychology, public health, epidemiology, all these things are related with health. So in total we can tell that what do you mean by health economics? It is a broad sub discipline of economics Under the economics, one of the scope or one of the branch is health economics. So it is concerned with maximizing the benefit within the available resources. It overlaps with a number of topics, both within and apart from the health and medicine. So it really deals with medicine, health, sickness, care, all these things. It encompasses more than economic value alone. So you don't think that it is only related with money. No. Health economics is highly related with health and how they manage the resources. So let us see what is the goal of health economics. To be very clear, the main goal of health economics, it has only one and important goal. The main goal is to provide the best quality health care to the largest number of people in given available financial resources. So it is very clear from the line, it provides the best quality health care. They would like to provide the best quality health care to a large number of people, because we all know that a country like India, which is having a huge population, or a country which is facing population explosion, so it is very important to have a proper health economics. Then only we will be able to utilize the available financial resources in the health sector wisely. So the various scope of health economics are the healthcare demand. We have to see the healthcare demand. What is the demand? Then we have to take care of the supply. According to the demand, we have to provide the supply. Then microeconomic evaluation at a treatment level. We have to see, we have to evaluate at the treatment level. Then market equilibrium, we have to stable the medicine rate, the diagnostic evaluation rate, surgery rate. So market equilibrium we have to see in the medical field. Then evaluation at whole system level, not only the public sector, the private sectors, everywhere we should have a proper balance. All over in India there should be some norms related to health services. Then planning, budgeting and monitoring the various mechanism. So these all area health economics really shows the scope for that. So now let us see what are the causes of increasing healthcare cost, or why we need a health economics. So when we are, as I have told, we have scarce resources or we have less resources and we have plenty of population. So it is there is a high need of health economics. The same way we have a increasing cost in the healthcare sector. So let us see what are the trends or issues, or what are the things which why we need the health economics. All these things we have the same answers. So when you look into the notes, you have seen plenty of things I have given. So some of the reasons I will discuss with you, like we have a increased use of healthcare system nowadays. Since the air is polluted, soil is polluted, water is polluted, everything what we get is polluted. So of course the disease rate, or new diseases which is erupting, or new communicable diseases are coming, new infectious agents are coming. So really we all need healthcare system. There is an increased use of healthcare system. Then the medical advances, like we have nowadays organ transplantations, gene therapy. So there are new therapies which has came up. So of course this whole area we need the health economics should have a control over it. Then cost control, because we all know that the test, diagnostic evaluation, otherwise the drugs or the expensive technological and equipments used in the hospitals, all this, then the wages which is given for the nurses, health medical professionals and the paramedical professionals, all these things, each of the hospital it varies. There is no proper control over that. So these all things really they need a health economics. Then medical malpractice, we all know that nowadays it is getting more number of medical malpractice, especially in the field of organ transplantations. Then medical liabilities, like insurance field, like some people those who are working in government sectors, they have insurance, the others they have private insurances. But many areas we know that the hospitals they utilize the insurance, and they unnecessarily they make or enlarge the bill, because it is paid by agencies or it is paid by government. So many illegal things are going on in even in the insurance field. Then the high cost of medical technology, the high cost of prescription drugs, Even I would worry to tell you that there are doctors who prescribe the drugs which are more costly, because they get more money from that, because they act as an agent between the pharmaceutical companies and between the public. So these all malpractices are going on in the field of health. Then one thing is, our life expectancy is getting more. We have a growing elderly population because their life expectancy is getting more. They are non-productive group. Then changes in family structure and norms. Previously, we all had a joint family system. There were all elders in the family. We were all were taking care of the food, all these things. But nowadays, everywhere nuclear family. Everybody has turned into the nuclear type of food style, like pizza, sauce. If you look back around few years back, there was none of our parents or grandparents have never seen this sauce, sausages, otherwise all this pizza, cheese, all these types of things. Nowadays, we started consuming all these things because westernization is influenced. We would like to adopt the food style of western side, because many of them work outside. Many of our family and relatives are settled in abroad. Even many of us prefer to eat outside, not from the family. We would like to go outside having a dinner from outside. So when many days it happens, automatically it will affect the health. Then the higher expectation among the general population, because they expect more from the health field. Why the hospitals, why can't they do like this? Why the doctors can't do like that? For all these things, economy is needed, or they want a stability. Then regarding the public awareness about the health, everybody is well aware about the right of their health. They all have a right to get good healthcare facilities. Even though in India we don't have 100% of health insurance, but still all the people are very aware about the health and their rights. Then government problems, like government policies and regulations. So they have their own set policies, they have their own set insurance policies. So all these things, they all ultimately need a health economy to control, to have a control over it. Then in private sector, we all know that a large number of firms do not offer health insurance for their employees. So many of them, they take out from their own pocket to pay for the health bills. Then the presence of third party agency, like especially we can tell physician also can act as a third party who really prescribe where to go for a diagnosis, which medication you should take, which type of surgery you should undergo. So always there is a chance of having a third party. Then competition among the various health organizations. As we all know, we have plenty of health services like public sectors and private sectors, indigenous sectors, voluntary sectors, many area. So they have a competition. Sometimes we may think that competition is very good because it gives us the best of the service. But sometimes what happens is, the consumers, they may not take up the good choice of hospitals. Sometimes due to high risk cases or high cost patient, some hospitals, they used to avoid them. No, we should not admit this type of patient because it is high risk. They may have more death rates. We should not take up these patients because the patient is BPL family. We cannot take up because the surgery he has to undergo is of very high cost. So such type of things happens. Then many of the private agencies or private hospitals, they avoid the research wing. They don't do any inputs into the teaching and research side. So they just think about the patient care and the billing system. So these all things we can tell, it is all leading to a high need of a health economy. Then healthcare rationing. You may know the word meaning of ration. Yes, when we get the health also as a ration, we all know how we get the ration from the government side. The same way, if health is also provided as a ration only for few people it will be getting more, few people it will be getting less, and the quality, if it is compromised, all these things happens, then really we will have to face much more difficulties in the healthcare sector. So this is all about what is the need of a health economics. When we have to face all these things, really we should have a proper system of health economics. Then only we can able to overcome all these problems. Now let us see what are the principles of health economics. So when we tell about the principles of health economics, there are mainly two terms. The first one is microeconomics, second one is macroeconomic. So from the word itself, you will be able to tell what is micro. It's a small aspect. So it deals with the behavior of the individuals and organizations and the effect of those behavior on prices, cost, and allocating and distributing the resources. So in a definition form, when we can tell that the microeconomics means is the study of particular firm or household or individual prices or the wages, that means the salary what they get, and the income, the individual industries, particular commodities. Only we are thinking about the micro aspect, either a home or a individual person or a small industry. We are not thinking about the national wise. We are not thinking about state wise or central wise. We are just thinking about an individual, their family, their expenses, household expenses, their income, and maybe a small industry what they take up, or their own shop. That's it. So it is mainly, there are three factors which affect a microeconomy, that is the supply and demand, the efficiency, and the effectiveness. So the supply and demand, these two factors are interrelated to each other, because if there is no demand, then there is no supply. But if there is good demand, then there is good supply. And the cost of demanding object will be the higher. We all know that if something is very high demand in the area, then the cost will, of course, it will get higher. For example, during this COVID-19 pandemic, when it started, you all know the people were running for hand sanitizers, masks, all these things. Suddenly the government has told that there should be a standard rate, and they have tried to put down the rates, because during that time I hope they were taking even 20 rupees for a single disposable mask. So when there is a demand, of course the supply will get higher, and of course the rate also they will increase. So it affects the microeconomics, or a household or an income person, it will get affected. Then the efficiency, that means it refers to producing maximal output such as goods or services using a given set of resources such as labor, time, and money. With the proper time, labor, and money, we should take out of maximum product. That is meant by efficiency. Then effectiveness. Effectiveness, as you all know, it states like we can tell the goal or the objective, or how well a program or a service does. So how much effective it is. Like if a government is providing a health service, we have to evaluate how much the program is effective. So supply and demand, efficiency, and effectiveness is the three things which directly, these are the three factors which directly influence the microeconomy. So let us see what is macroeconomy. Macroeconomy means it deals with large scale or general economic factors such as interest, rate, or national productivity. So when we tell about national productivity, because overall in whole India, or the whole state, the whole large scale economy we are going to see about, it is having two factors which is affected. Like it is the GNP and GDP. What is GNP? Gross national product. And what we have is gross domestic product. So the gross national product and the gross domestic product are the conventional terms used to understand the performance of the national economy. So if we all want to see how the economy of the particular country is going, we have to see about the gross national product and the gross domestic product. So if it increase, then only we can tell that we are growing higher, or higher in the economical side, or economically we are getting higher. So these indicate the sum total of three components in a country. That means the personal consumption, expenditure of goods and service, and the investment expenditure. So how much we invest, how much is the personal consumption, and how much expenditure we do for the goods and various services. So we have to remember these two words in macroeconomy, that is the gross national product and the gross domestic product. Now let us see about the various sources of healthcare financing. how the healthcare is getting money, or healthcare financing is how it is happening. So when we tell about financing, how they get the money, even in the public or in the private side, how they get the money, this is through this mainly through these three things, that is third party payment, direct consumer reimbursement, and private support. What do you mean by third party payment? Third party payment are monetary reimbursement made to providers of healthcare by someone other than the consumer who receives the care. Like for example, we can tell, especially we have four types of third party payments. One is private insurance companies, because you go, you get admitted in the hospital, you have undergone a surgery, but the money is getting paid through your private insurance company. Next one is independent health plans. So you have take upon your own health plans. They used to get the payment. Independent health plans. Next is government health programs. Some of the surgeries or some of the treatment government is paying. Next is claims payment agencies. Sometimes your organization, they may provide the support, or they may claim, or they may tell that if you or your parents or your blood relatives or your first line relatives, if they all are having any of the medical condition, or if you all have to undergo any surgery or any inpatient department in the hospital, any of the you, if you are getting admitted in the hospital, they will pay you for that. So these all are the third party payment system. Next is the direct consumer reimbursement. What do you mean by direct consumer reimbursement? It is the second major source of healthcare financing, which comes from direct fee payment by the consumers. You are getting admitted, you are paying the bill from your own pocket. That means it refers the individual out of pocket payment. They only will pay directly. The third system is private support. Private support or the philanthropic support. What do you mean by philanthropic? This word already we have seen. What is philanthropic? Like yes, donation, or somebody is donating. Like especially voluntary agencies. If you are not able to pay the things, somebody else, the voluntary agencies, some of them, they do the funding. They support you financially. Or some private agencies, they support you. This is about private support. So through this three billing system, the healthcare financing is going on in the public and private sectors. Now let us see what is the role of nurse in health economics. Now we have seen what is health economics, we have seen what is microeconomics and macroeconomics, and how a nation controls it, or how a family, all these things we have seen. Then now you tell me, or now you think, why as a nurse, why we study health economics? What is our role in health economics? Yes, of course. We also have a very big role in health economics, because we are the people, or we are the professional people who really makes a huge part of the health sector. The nurses play a central role in cost containment, cost, care quantity, and patient safety. Like cost containment, we are going to see the particular word. What is cost containment? Cost containment means nothing else, we have to maintain the cost care. The care of cost should be maintained, cost containment. Then care quantity, how much quantity of care we provide, how quality we provide the care. Or the patient safety features, everything is in our hands. Nurses actively engage in leading efforts to improve patient care and reduce the cost. They really put various efforts in reducing the cost, and same way improving the patient care. Then healthcare issues and trends. There are various issues happening in the healthcare system, and there are so many new trends happening. These all things are balanced by nurses. Nurses actually, they act as a cradle between the medical field and the public. Then governing on behalf of stakeholders. So even though there are so many people investing in the healthcare field, we are actually behalf of that. We are actually governing the system. Because if we do a strike, or if we do ask for a high amount of financial support, then of course there will be a huge shake in the healthcare sector. Then we really build a culture of quantity, quality, and safety. The quality and safety, the both of the things are in the hands of a nurse. And monitoring the financial performance in each hospital or in each ward or in a surgery, everywhere, like see, nurses are working together. Nurses are really the backbone, we can tell. So if a nurse really provide proper care, then there will be speed, and the speed of recovery will be very high. Then of course the financial performance of the hospital, or the quality and safety, everything will be improved. Then monitoring of quality performances. So if we provide whatever care we provide, everything is monitored. So the providing the quality care, nurse is having a high role. Then in setting the policy that guides care delivery, how the care should be delivered to the people. In setting the policies, on the policy making, or setting the strategy to help to ensure the future health. This all nurses has a vital role to assume a valued community leadership role. So nurse means you never think that like we are just working as a staff nurse. No, we are having so much of administrative roles also in a hospital. From the nursing superintendent, then ward in charges, then health educators, health coordinators, even the nurses who do their continuing education in MBA, they can be in the business management side also. So they set the strategies and policies. They can have a very good leadership role also to help the boards to identify, clarify, and focus on what the need of the patient, what the patient really needs. In order to identify the need of the patient, in order to clarify that, in order to focus on what the patient need, then really a nurse is highly needed there. Then to share the patient needs and concern and ensure the safety and quality care. So again and again, around 3-4 areas they have focused on the quality care. So the quality care provider is only the nurse, we can tell, because the doctor hardly spend very few minutes with each patient, but the nurse is the person who really spend her time, quality time, during the care aspect. She makes the speed of recovery. She determines when he can get discharges, because if he is improving like anything, then of course the doctor will prescribe, yes, tomorrow, day after tomorrow he can get discharged. So all these things are in the hand of a nurse. So this is all about what you mean by health economics. So in health economics, what all we have studied till now? We have studied about what is health economics. You have to remember what is the definition. At least one definition you all have to remember. Then we have studied about the various disciplines which is related with economics and health. The goal and scope. What is the goal, ultimate goal of health economics? And what is the need of health economics? Why it is needed? What are the principles or various branches like microeconomics and macroeconomics? We have seen gross national product and gross domestic product. Then we have seen what are the sources of healthcare financing, third party payment, direct payment, and private support. Then we have seen the role of nurse in health economics. So with this, and let me conclude today. So in the coming class we will see about the other aspect, like we have to see about the cost analysis and cost containment, and we have to see regarding the family budgeting. Then only this unit will be completed. So tomorrow we will be seeing regarding this small 3 topics. Thank you, students.